This has been a bad week for the flu vaccine. Canadian health officials are saying it is such a poor match with the virus that it may give almost no protection to adults. And now new research is showing that receiving a previous year's vaccine could even make you more vulnerable to new strains. A finding that seems to challenge the current public health message to get that flu shot every year. CBC medical columnist Dr. Peter Lynn joins us now to sort out what this means. Sorry, you're on the hot seat today.
This is bad.
Because, you know, it's a debate every year, and public health officials urge Canadians to get that flu shot. Now I briefly touched on some of the news. So let's start with the fact that we are hearing that this year's flu strain is just a bad match. The vaccine and the flu that's out there that is really going around now just don't really match.
Yeah, so basically they have to predict which strain is going to come in February because they need that much time to actually make the vaccine. So if I went on to the Flu Watch just to see all the tests that we're getting, so we could see on this graph, if we could pull that up, that basically if you look at the bars, those are all the tests that we've had for the flu across Canada. And you can see it's somewhere between 4,000 and 5,000 tests are done. And that nice pink area, that's the H3. So that's the one that's in the vaccine. So that one would have been covered by the vaccine. All the gray stuff, those shaded areas, those are untypable. In other words, it could be H3, but it could be other strains as well. So as you can see, most of them are of the other strains and not the H3.
As you say, the decision on every year's vaccine has to be made way back in February of the year before, so it's almost a bit of a guessing game. Well, given that we now have this evidence about how ineffective it can be, what does that do to the message then to get that vaccine every year?
Yeah, it's more complicated. And the other thing, it becomes even more complicated because we used to say, even if there's a mismatch, you should get some cross protection.
Right.
You'll get a little bit of benefit. And that's probably still true. But in 2009, a group of BC researchers, they were looking at this. If you got the seasonal flu shot, did it protect you against that pandemic one? And to their surprise, in fact, it increased your risk of getting the pandemic flu, the H1N1.
Right.
And so, therefore, at first, people thought this is just Canada. It's nowhere else in the world. And then what they found was that it was happening in Hong Kong. It was happening in other countries as well. This strange phenomenon where if you get the seasonal flu and a new one comes and hits, you're actually more likely to get the new virus and get infected.
So can we assume that that's the case then? So this, I gather this is people who get the flu shot regularly.
Right.
You can actually be more susceptible if a new strain comes along. You could actually be hit harder, is that right?
Yeah, and the idea here is that they don't really know why this is happening, but there's two theories. Okay. The first one is this. The vaccines now are very specific. It's like I teach your body to recognize this thing.
Yes.
And then you make your armies against that thing. So now your army is busy making this, your factories are busy making this, and then a new one comes along, well, your factories are busy making this, they're not making this one. And so that might be one explanation why that other virus can sneak in there. The second thing is possibly, let's say I make the army against this virus, that's the seasonal one, and this new one is quite different looking, but my army attaches to it, but instead of killing the virus, what it does is that it escorts it and allows it to get into your body. It's almost like an entourage.
Oh dear.
And say, come on in, you know?
Yeah.
And then that allows the infection to go on. So these are the theories that they're working on. But remember, that's only in a situation where there's seasonal flu that you got the shot for, and then you get a very different strain that comes on top. They think that that's the unique situation that we saw in terms of the vaccine not working so well.
Something we're not going to see terribly often, is what you're saying?
Hopefully not. And that's what the public health folks are saying. And so therefore, if you're over 65, if you're sick, you know, lung disease, heart disease, those types of things, they're still recommending get the shot. Even if it's 20, 25% protection, at least you're getting 20, 25% protection. And hopefully this story about this new virus and things like that, they'll sort out. But right now, the recommendation is still to get it for the elderly, for the sick, and then for the people that get it.
Children too, sorry?
Children as well.
Okay.
And then for all the folks that either got the shot or didn't get the shot, do all those simple things. You know, don't put your hands up to your face because that's how you'll move the virus. Wash your hands, don't shake, don't sneeze at people. Those simple things are still going to be very, very helpful.
Final thought, is all of this just telling us that really when it comes to protecting the population with the flu vaccine, we've got a long way to go? We're at the beginning of the learning curve, it sounds like.
Yeah, it basically says that as we got more specific, we gave you just this thing to recognize. We made the side effects of the shots better, so you didn't react so badly, but we didn't recognize as many parts of the virus. When you get sick with the flu, you actually make an army against all sorts of different parts of the virus, and that might actually protect you against other viruses in the future. So we'll see how they do this. More things they put into the vaccine, more side effects, but more protection perhaps as we move forward.
It's lots for people to digest as they make that decision, but just to recap, your advice, if you're over 65 or for young children, if you're health compromised, still a good idea to get the shot then. All right, thanks for clearing it up for us.
Thanks, Jennifer.